For those of you happily collecting salt, Maggi, sewing machine, grinding machine, fridge and others, and celebrating and praying and blessing, just know that it is the money that would have been used to give you a better health care, so that you don't die while trying to give birth, so that your daughters don't die while trying to bring forth life, so that your sons and daughters don't die from snake bite simply because there are no anti-venoms in the hospital. It is the monies that are meant to build proper health care, proper education, good roads, and give you a better life that have been, embezzled and are being used. Part of it, a very minute part of it, is being used to give you rice, Maggi, and salt, leaving the basic health care and other facilities that you need aside. Let's see, some of the consequences of choosing rice in Maggi and salt and other condiments over a working system.
A popular Abuja-based content creator, Decca George, is mourning the death of her 36-year-old sister, Amaka, who passed away at a general hospital in Abuja after the facility had no oxygen available during a medical emergency, and Amaka was pregnant. In an emotional tribute, Decca revealed that she missed her sister's calls because she was in Lagos attending court hearings, fighting a legal battle stemming from a consumer dispute with a hair vendor known as Rainbow Hairs. She wrote, "Life is so fickle. My sister would have been alive today if I didn't have 2 court cases in Lagos. You called, but I was being dragged from magistrate court to federal high court. You called, but I missed your call because I was busy fighting for my life and freedom in Lagos. So I missed the opportunity to save you. I am sorry, Sister Amaka. I wish I could go back in time. I would be with you in Abuja and we could have saved you. A whole general hospital didn't have oxygen. Nigeria failed you. I failed you." This is such a touching tribute. Oh, may her soul rest in peace. We reached out to, one of her sisters. We are being told that the incident happened at the Buhari General Hospital. Imagine a pregnant woman dead because a general hospital had no oxygen. This is not just Decca George's tragedy. This is Nigeria's tragedy. A young mother and her unborn child lost, not to an incurable disease, but to a system that failed them completely. We're hearing these sort of stories every day, Ayo. It's becoming a norm.
Yes, it's heartbreaking. It's been a problem we've had for a number of years, but I'm glad that now, it's receiving the much needed attention. But it's not just about us talking about it. If we discuss this, we have the statistics that the United Nations, the World Health Organization, has released a number of times without attendant response. We'll continue to talk about it like this. I'll first of all reach out to Decca George, Lady Decca George, and say that I hope that she will not blame herself for this, because even if she were there, if the hospital didn't have oxygen, it would still have ended this way. Please don't take on the responsibility of what is a failure of state and our hospital or healthcare system. Our condolences to you. But OG, the statistics are stark. Nigeria has one of the highest number of maternal mortality rates. In fact, a woman in Nigeria has 1 in 9 or 1 in 22 chances or the risk of dying. And the highest contributory factor to this is poor healthcare facility, poor healthcare management. So we put this solely on the feet, or largely on the feet, of governments that have failed, mismanaged funds for many years, neglected the health sector for many years, and have ignored this part of society. So what we are calling for is that women like Decca's sister ought not to die because of a process that in other parts of the world, even though there are risks attached to it, the risk has been reduced to a very minimal level. We can do something about it, and kudos to the NGOs who are already working in this sector. But Nigerian government, please wake up. Stop killing our women, stop killing our children, stop killing Nigerians.
If I had
thank you for giving me the time. During COVID-19 pandemic, the federal government initiated the construction and rehabilitation of oxygen plants in Abuja as a part of national strategy to tackle critical oxygen shortages. Establishment of new plants, rehabilitation of existing ones, emergency supply. The project, which was included the construction of plant houses and installation of equipment, was estimated to cover 5.6 billion. The question is, where's the accountability of this project? Where's the oxygen plants they built during COVID?
Yes.
How was this 5.6 billion spent?
This was a
That's
general
the question we're asking.
Very good question there. Very good question. May Decca's sister's soul, Amaka, rest in perfect peace.
Welcome back. How long do we want to continue like this? Are you not tired of collecting Maggi rice, salt, Indomie and co. while you die of curable diseases simply because there are no healthcare in place?